Is scar tissue always normal after surgery? Imagine your body as a busy construction site. When you get surgery, it's like a repair crew building new walls. Scar tissue is part of that process, but is it always a sign of normal healing? Let's find out. After surgery, your body kicks off a healing process that starts within the first day. It produces collagen, a protein that forms scar tissue to close the wound and make it stronger. This process goes through several phases: inflammation, tissue formation, and remodeling. The entire process can last from a few months up to a year or more. Now, scar tissue itself is a normal part of healing. It's your body's way of sealing the wound and preventing infection. But how it looks and feels can vary a lot from person to person. The location of the surgery plays a big role. Joints like knees, shoulders, or elbows tend to develop thicker or more noticeable scars because they move a lot during healing. The abdomen or upper chest might have less visible scars, especially if the incision is small. Individual factors also matter. Age, genetics, and overall health influence how much scar tissue forms. People with a family history of keloids, which are raised and thick scars, often develop more scar tissue. Younger people tend to produce more collagen, which can lead to more prominent scars. Surgical details are important too. Larger cuts, wounds under tension, or infections can increase scar tissue formation. If the wound is stretched or irritated during healing, it can lead to thicker or raised scars. Scar tissue differs from normal tissue because it's made of collagen fibers that are disorganized and crisscrossed. This makes scar tissue tougher, less flexible, and sometimes less blood flow. When scar tissue forms near joints or deep under the skin, it can cause stiffness, discomfort, or pain. Sometimes scar tissue can become problematic. It might contract or tighten over time, which can limit movement. It can also cause pain or irritation, especially if it presses on nerves or muscles. Large or raised scars may be a cosmetic concern for some. Scar tissue can keep contracting for up to 6 months or even a year after surgery. That's why ongoing care is important. Keeping the wound moist helps healing. Gentle movement and physical therapy can prevent stiffness and improve flexibility. Massaging the scar or using special silicone sheets can reduce thickness and make scars less noticeable. In some cases, doctors might recommend steroid injections or other treatments to control excessive scarring. So, in simple terms, scar tissue is a normal part of healing after surgery. It helps your body repair itself. But how it looks and functions can vary. Most scars heal well without issues, but some may need extra care to improve their appearance and your comfort. Always talk with your healthcare provider about the best ways to manage your scar and support your recovery.